welcome back. This is Deanna, and today we are going to talk about the COVID-19 on the voice of diabetes. So I'm really excited because I want to talk to you guys about the COVID-19 vaccine side effects. Obviously, I am in the front line, so I got the vaccine. I got the Moderna because that's what was given to me. I didn't get to choose. With the shortage, obviously, that we have, we're not going to get to choose, but it really is comforting knowing that both are really, really good vaccines. The studies are absolutely amazing. So I wasn't worried about which vaccine I was going to get. So about the side effects, we know that a lot of the side effects of a vaccine are studied in phase 1. So that's when they really study the safety of the vaccine. They look for any major side effects, any severe side effects, and then they move on to phase 2 and then phase 3 and so forth before the vaccine is actually released to the public. So I got my first COVID shot, and it was a Moderna shot, as I mentioned. The first day, I got the COVID shot and I came home. After a few hours, I did have some arm soreness, which was expected with the intramuscular injection. And next day I went to work. I was perfectly fine. After I got home from work, I started to feel a little bit run down. I wasn't in my usual bubbly, energetic self. I was kind of just hanging around, watching TV. I think I watched a whole TV movie on Netflix, which I normally don't watch too much TV. So that's how I knew I was kind of run down. The second injection, so I got the second injection 28 days later of the Moderna. So I got the vaccine on a Friday. I purposely scheduled it on a Friday because I would have the weekend off, and I was anticipating a little bit more side effects because of everyone around me that had gotten the vaccine had more side effects with the second injection. So with the second injection, I got the vaccine on Friday morning around 9:30 in the morning. I came home. I felt perfectly fine. I started to feel some arm soreness again, which I anticipated, and I took some Tylenol before bed. So when I woke up in the morning, I definitely did not feel like myself. Luckily, I was off that day, so I didn't have much to do. I felt more run down. I did have some chills. I didn't have any fever. It could have been the Tylenol probably suppressed my fever if I was going to have some. But I did feel more body aches, a little bit more tired than usual. I didn't have any loss of appetite. Obviously, I was still eating. I was still, doing things around the house, but I was very sluggish. So that day I kind of took it easy on myself. I didn't really do much. And then I woke up on Sunday and I was 100% better, as if nothing had happened. So those were my side effects. Actually, a lot of people in the office that got it, a lot of the other doctors in the office, they had about similar side effects as me. So it seems to be across the board that a lot of people are having some mild body aches, maybe some fever, some chills, and then they go away the next day. Should you be worried about these side effects? Absolutely not. These are actually pretty good. Because it shows that the body is kicking in, the immunity is kicking in, so the antibodies are being produced that you need. If you were to contract COVID-19, you'd be ready to fight and you wouldn't get as sick as you would without the vaccine. COVID-19 vaccines are mRNA vaccines, messenger RNA vaccines, and these are 95% effective, which is probably one of the best vaccines we have so far. Tetanus is number 1, that's about 100% efficacy. And then COVID is right down the list there on the top 3 or 4 vaccines that we have. That's, the most efficacious. 95 is pretty good, guys. That means you're getting 95% protection from COVID-19. I really encourage you all to get the vaccine. Please make sure that you are getting the right information if you're choosing not to. I would hate for you to not get such a great vaccine because you're misinformed. A lot of these sites, a lot of these social media articles are actually not accurate. They're not, truthful. These people are not, scientists, they're not doctors. They're not in the medical field. So far, I am very happy to say that there has been 0 deaths because of COVID-19 vaccine, 0 hospitalizations, and 0 deaths during the clinical trial. So I know that there were some articles, huge headlines, person dies after receiving second dose of COVID-19. I actually read the whole article. I looked into it, and that was not the cause of their death. So please, I encourage you to make sure that you are getting the right information before you make a decision. for not getting the vaccine if there is any reasons why you shouldn't. Because I encourage all my patients, especially all my diabetic patients, to get the COVID-19 vaccine. I want you to be protected, and it's the only way that we're really gonna build herd immunity. We need at least 75% of the people in the nation to get vaccinated so that we can lead more normal lives. Otherwise, this is just going to continue to go. So we need as many people to get this wonderful vaccine. If it wasn't so great, believe me, I wouldn't have gotten it. Dr. Fauci wouldn't have gotten it. All these wonderful scientists, smart, world leaders, all of them would not have gotten the vaccine if it wasn't as great as it is. So the studies are just absolutely amazing. So please take a look at them. And if you are reading some crazy headline, make sure you really, really investigate because a lot of these headlines are misleading. So I hope you guys enjoyed the video. Don't forget to subscribe. Don't forget to like, comment, and share. So I hope that we are going to lead more normal lives. I hope we are going to have a better summer than we did last year. And I hope you guys are all staying safe, staying well, social distancing, wearing your mask, and getting your COVID-19 vaccine.